Remember your awkward preteen and teen years. Some of that you may just want to have amnesia about: braces, oily skin, acne, and you think it's behind you. But acne sometimes can persist in adult years. Why do we get acne and what can we do about it? Dr. Summer Moon joins us with helpful information. Hello, Dr. Moon, how are you?
Wonderful, thanks again for having me.
Hey, before we get into the acne discussion, congratulations, 5 years in a row, Best in the Bay, Bay Dermatology, huge accomplishment.
We do the best we can with the gifts given. We love caring for people at Bay Dermatology.
We can tell you do. You're doing a great job. And speaking of caring for people, you do have folks come in, whether it's teenagers, adults, and they're dealing with acne. What is acne, if you can kind of just categorize it for us, because it could be mistaken for other conditions?
Yeah, so acne actually occurs in all ages, as you mentioned. It starts at even 6 years old, we're seeing it now, and all the way up into the 80s. We have patients coming in and saying, I have these clogged pores, the milia that are really disturbing them. So acne is one of those things where it can start off as like little blackheads or whiteheads and then go into these painful lumps or bumps or cysts. And then even as an adult, you can have the acne rosacea or even the hormonal acne, which is kind of a really hot topic right now.
Right, because I heard about people who get testosterone pellets, hormonal pellets, and that can trigger acne and hair loss. Is that something you're seeing from these different treatments where you're trying to treat another condition?
Yes, yes, ma'am. So although those testosterone supplements are amazing for boosting mood and endurance and all those wonderful things, but it does have side effects such as hair loss and even the acne. And typically when we see that acne, it's in the jawline, the chest, the back, and even the trunk area. And so it's really frustrating for patients because they're feeling wonderful, but then they come in for a little bit of hair loss and even some acne. That's pretty disturbing for them.
And so how can they be treated when they come in for those conditions?
So, you know, when you're talking about a young kid, you know, it can be just the over-the-counter retinols and even benzoyl peroxide washes and salicylic acids. As you move into adulthood, especially the hormonal acne in general, there's anti-androgens. There's actually spironolactone, which helps orally. There's oral contraceptive pills. There's topicals called Axone or Winlevi. And then, you know, kind of over and above that, it would be kind of talking to maybe the hormone doctor and seeing if they can make some modifications or adjustments based on what the symptoms that they're experiencing.
Sure, back off those hormones. You know, you get to the point with acne where you're saying, you know, you see it every day. Sometimes it doesn't come on strong. It's just a gradual process. At what point should you say, I need to go and see my dermatologist and make sure that I'm doing something so it doesn't get worse, and so it does get better and I feel good about myself?
So typically if you start with just an over-the-counter like CeraVe acne wash with benzoyl peroxide or even the salicylic acid, and the over-the-counter different, but at some point you say, you know, I'm looking in the mirror and I'm just really frustrated, then I think you should come to the dermatologist because we can help you. We can come up with a customized plan based on your acne and how it's developing over time. And with that being said, we can kind of target your therapy or your treatment.
I've heard too that, you know, you mentioned along the jawline when it's a hormonal thing. I've also heard that based on where it is on your face, that can indicate certain problems. I mean, sometimes you get on the forehead, that might be because of your hair products. But
you're exactly right.
Then cheeks, digestion,
Could be, yeah.
Okay.
Yeah, the acne rosacea, typically on the nose, cheeks, triggered by wine, spicy food, cheese, heat, chocolate, caffeine, stress. Who doesn't have that?
All those things that I enjoy.
And then, like you said, the hairline acne, you know, can develop from your scalp, which is a really important thing. So based on when you come in, we can kind of look at it together and come up with a wonderful treatment plan for you.
Well, thank you so much, Dr. Moon. Of course, the information is on the screen. Loved talking with you. There you go. Reach out to baydermatology.com. Don't suffer with your acne. You'll find treatments. Thank you.
Thank you. Thanks for having us.